and Mazza. Welcome to Wellness Woodbridge. I am your host from Vito Mazza Salon and Spa and Hair and Scalp Wellness in Old Bridge. And today we're going to talk about a topic that I have been wanting to discuss since I started hosting the show. And that topic is mental health. I have Dr. Nicole Pensak here with us, and she is a clinical psychologist, and we're going to talk about anxiety and depression in this first segment today. Hi, Nicole. How are you?
I'm great, Anne. Thank you so much for having me.
I'm so glad you're here. I am so glad you're here because I think this is a topic that definitely affects people in some way, shape, or form, whether it's someone in their family, a friend, or them themselves. We've all had moments of anxiety. We've all had moments where we're feeling depressed or down. So it's going to be great to speak with you today to kind of target how we can get help, if we need help, what are the signs for help. So tell me a little bit about yourself and why you chose to do this as a profession.
Sure. So I'm a clinical psychologist, and I specialize in treating adults with anxiety, depression, parents of children with anxiety, and also I practice medical psychology. So I work with patients with chronic illness such as cancer and other medical problems. And I started out in cancer prevention research and health behavior change research. And then I did my predoctoral internship at Yale New Haven Hospital, focusing on transplant and oncology and palliative care and women's sexual health. And then I went on to my postdoctoral fellowship at Massachusetts General Hospital, specializing in psychiatric oncology. And then most recently, I did a research fellowship at University of Colorado Anschutz Medical Campus, working in palliative care and aging. And I've always been passionate about working with patients with depression and anxiety, and throwing the medical problems into that. The complexity makes it even richer. So it's just where my passion is. And my research focuses on disseminating evidence-based treatments that work, and I'm just an advocate for doing that for my patients.
That's wonderful. So tell me, I mean, you see clients, you're going to be seeing probably even more clients, and I know that research is such a huge part of what you do. What do you see? What do you see when you're treating patients with anxiety and depression?
That's a great question. So, well, I treat the whole person, okay? But there are a whole host of symptoms that can occur when you have anxiety. But let me just step back and say that anxiety is a normal human response. From an evolutionary perspective, we have anxiety to alert us to dangers in our environment. So back in caveman days, we would feel anxious when we would see a tiger, so we would run from it. And that's a very normal reaction. What happens with anxiety when it becomes maladaptive is that it's sort of like a faulty alarm system, and your emotional response is disproportionate to the danger in the environment. So, for example, someone with a fear of public speaking would feel very anxious. You can feel overwhelmed, extreme worries. You can have physical symptoms such as muscle tension, heart palpitations, racing thoughts, sweating. These are all symptoms of anxiety, but public speaking isn't a dangerous activity. It's not a threat.
No.
But your body and your mind react in a way that tells you it's dangerous. So as a result, people avoid the activities that make them feel anxious. So typically what I see are those host of symptoms of anxiety and then the behavioral avoidance. So they're avoiding either public speaking or social engagements, or sometimes leaving their house even. It's a common problem.
I found I had a little bout of anxiety myself, and I was about to get a hysterectomy. So I think my hormones were a little bit off, and I just would get that tightness in my chest and the heart racing and sometimes tingling in my fingers and all these terrible symptoms. And then I think the anxiety itself tends to bring on more anxiety, and before you know it, you're just like a mess. So it's very hard to control it because it just seems like the anxiety itself is what makes more anxiety.
Exactly. And people have a fear of being anxious also. So with panic disorder, people have panic attacks, and then one of the diagnostic criteria is fear of having another panic attack. So it is that downward spiral.
So how do you talk to patients about avoiding it, or do they avoid the situations, or is it best to go head on and
So the treatment for anxiety is actually counterintuitive. So as a person, you want to avoid the things that make you feel anxious, right? That seems natural because then you don't feel anxious. However, if you continue to avoid the things that make you feel anxious, you reinforce that relationship, so it exacerbates that anxious response. So patients may not want to hear this, but I actually help them face their fears.
Okay.
But I give them the skills to help them cope with the situations at hand. So people with anxiety tend to overestimate the threat in the environment and underestimate their ability to cope. So I provide cognitive behavioral therapy, which is evidence-based. So in the literature, it's shown to be very effective for treating anxiety. And I tailor that to the unique needs of the clients because, again, I treat the person, not the symptoms. So I also integrate interpersonal techniques and psychodynamic approaches.
Wonderful. How do you feel about holistic therapies in cooperation with that? I know at the time I went for acupuncture, or you can do massage therapy.
Yes.
How do you feel about using those modalities?
Absolutely. I'm an advocate for using all of those modalities. They can be very complementary to the work that I do with my patients. So.
And what about time frame? Like if you're treating someone with anxiety, what do you generally see? How long does it take for them to see a little bit of a improvement?
So it is difficult to make a definite estimate. However, cognitive behavioral therapy is meant to be briefer than other therapy modalities. So for example, with psychoanalysis, you're laying on a couch and you're seeing an analyst 3 times a week for years and years. The type of therapy that I provide is meant to be briefer. So most anxiety protocols are about 16 sessions. I've seen patients meet their treatment goals in as little as 3 sessions. I've also treated patients for years because what happens is that you may meet your treatment goals for anxiety and then another problem pops up or some other long-standing issue that you haven't addressed comes up. So it's really hard to say, but cognitive behavioral therapy is meant to be a briefer approach.
Okay.
And you see results very quickly. I love treating anxiety because the treatment works.
That's great. That's great. And now, how is anxiety different than depression?
So that's a good question. I like to say that both anxiety and depression are disorders of time. So anxiety is a misperception of the future. It's worries about the future, anticipatory, what's going to happen. Depression is a disorder of the past. So thinking about the past, ruminating about the past, and then it also comes along with some different symptoms as well. So depression affects about 15 million people in the U.S. That's about 6.8% of the population. And you would experience symptoms, disturbance in sleep, loss of interest, feelings of guilt, hopelessness, or worthlessness, loss of energy, trouble with concentration, changes in your appetite, so eating too much, eating too little, maybe some weight gain or weight loss, psychomotor slowing, which means that you'd be speaking or moving more slowly than usual. That would be noticeable to others. And then also suicidal ideation, that also comes along with it. Depression tends to affect more women than men, and you would also see in men, they present a little differently sometimes, so they might feel more angry or irritable. But those symptoms persist for at least 2 weeks, and they interfere with your daily functioning. So that's when you know it's time to ask for help.
So what do you think as far as is it all internal, the depression, or do you think it could be environmental factors? I'm sure it's a combination of all, but what do you think is the most involved with experiencing depression?
Yeah, that's a good question. We do know from the research that the more stressful events you have in your environment, the more likely you are to feel depressed. There's no one cause. We know that depression is a real medical illness, but it can be caused by a combination of things. So it can be caused by brain chemistry, genetics, environmental stressors, and personality factors. So it can be a combination. And what you really need is a thorough assessment by a clinical psychologist or mental health provider to really help you figure out, pinpoint what exactly is causing the depression for you, because everyone is different.
Do you think depression can be treated without medication, or is there always a medical component?
Absolutely. So as a clinical psychologist, I don't prescribe medication, but I work closely with medical providers that do prescribe medication. And I would say that medication can be very beneficial for patients that can't get out of bed or can't engage in therapy. I always recommend that patients, if they are on an antidepressant or medication for depression, that they also engage in therapy, because it teaches you the behavioral skills that can help prevent relapse and just get you further ahead. It can have a synergistic effect with the medication.
So if you're experiencing anxiety or depression, what do you think would be the warning signs? Let's start with anxiety, where you might need to see someone and get some help.
So that's a good question. I think that the warning signs are the symptoms. So are you feeling very tense? Is your heart racing? Are you sweating? Are you nervous about something? And then are you avoiding something? I think that if it's interfering with your ability to have relationships with others, to engage in social activities, to go about your daily activities, that's when you know it's time to get some help. It's really that interference.
And with anxiety, it could be maybe just talking about it. Does that really help clients just to talk about the stress?
So with cognitive behavioral therapy, we certainly talk about what's going on in the person's life, but it's a specific skill set. So cognitive behavioral therapy is a therapy modality that addresses cognitions, so thoughts, behaviors, and emotions, and there are specific techniques to work on each. So with cognitions, with people with anxiety tend to think very rigidly, right? So they have catastrophic thoughts and very grandiose thoughts. And so what you do is you work with the patients and help restructure those thoughts to more adaptive, rational thoughts. And then you give them the emotional coping skills, such as relaxation strategies. And then I also use exposure techniques. So it's a graduated exposure program where we start off small, but they basically master the skills, and then slowly they work up to facing their fears and moving into the situation that makes them anxious. And what happens is that the trigger, so the situation that makes them feel anxious, and their response at first is very strong. So for public speaking, if a person with a fear of public speaking knows that they have to give a talk, that's automatically going to cause them a lot of anxious symptoms. Okay, so it's a very strong relationship. What the cognitive behavioral therapy does is help them cope well with working up to the public speaking, and then it loosens that association so that they can feel relaxed while public speaking. And so the association begins to weaken.
Okay. So is there a such thing as generalized anxiety, where you can't really pinpoint what the one thing is, but sometimes you just have that feeling of uneasiness?
Absolutely. So generalized anxiety disorder is worries about a lot of things. It's across 3 different domains, and it's really pervasive. And you may not feel the intense symptoms such as sweating or heart racing. There's not like an acute anxiety response. There can be, but there may not be. And it just may be this consistent feeling of tension and worries about the environment, worries about relationships, worries about work. It has to encompass at least 3 domains in your daily life.
So how would you go about treating someone with that?
With generalized anxiety disorder, I would do a similar protocol. I would basically work with their cognitions and their emotional response to things, and then also engage them. But typically there's some avoidance. So if they're always anxious, they're going to be avoiding something, and maybe it's just relationships with others, or maybe it's not moving ahead at work because they worry about performance. But there tends to be some specific behavioral avoidance. So you work specifically on that, but you also target those cognitions that tend to be pervasive.
Okay. And now in depression, what would be the signs and signals for you to needing to go get help?
So depression, again, would have that host of symptoms. So trouble sleeping, loss of interest, low mood, feelings of guilt and worthlessness, all of the symptoms I mentioned before. But if it's interfering with your ability to go about your daily activities or your relationships with others. So again, like everyone has a low mood at times. Everyone has a lack of energy or trouble sleeping at times. It's just about how long you experience those symptoms and how often, and also what symptoms you experience together. So if you're having, 5 or more symptoms for 2 weeks or more, that meets the criteria for major depression. So I would say that's when you need to ask for help. And also, I'd like to say that many people think that when they feel depressed, they need to avoid things. They need to get in bed and just like kind of wait it out. But depression is not like the flu, where you sort of wait till you feel better and then you re-engage with the activities that you typically enjoy. You actually have to make yourself engage in those activities, and then you get the benefits from exercise or social interaction, and then your depression starts to lift. And in the treatment I provide, that's called behavioral activation, where we schedule these activities, and it's very difficult at first because it's counterintuitive. You kind of want to wait out the depression.
You almost want to succumb to it and just say, oh, I'm going to feel better tomorrow.
Exactly.
But then tomorrow just rolls in and rolls in, and it just doesn't get any better.
Exactly.
I was reading last night at Time Magazine did a whole article on happiness and all the different areas of our lives that either lead to or don't lead to happiness. And it was just very interesting to me, to see how you can affect your mood by activity. But one of the greatest points they made was, we're all attached to this phone. And the phone is leading to anxiety. It's literally causing us to always have another thing to do and to check and to double check. And they actually even talk about Facebook as leading to depressive thoughts for people, because they're constantly, I see it with my own kids, with Snapchat and with Instagram, and you're looking at other people's lives constantly, and you're balancing your life against their virtual life. And it is just, I think it can be mentally debilitating.
Absolutely. I mean, that it's when you're comparing yourself to others, but let me just say that social media can be very misleading. You can certainly take a picture that looks great and then know in the background that maybe you weren't feeling great or you were having a depressive episode, but no one would know because it's all filtered. So you just never know. So it's really tough to have that kind of pressure these days. It's a whole new epidemic, basically.
How do you counsel your patients, with that? Do you tell them to kind of take time off, maybe shut that down?
Absolutely. I would say that if a patient came to me and they were having those types of reactions, I would certainly recommend setting boundaries and protecting yourself. There's no need to expose yourself to that type of trigger for your mood, basically. And you have control over that. So you can't control other people's behavior, but you can take a step back and control your own behavior. And limiting that social media interaction is part of that. And it really makes patients feel more confident that they have control over that and can really impact their mood.
Well, it's formulating boundaries too in your own life. I find with myself, juggling family and professional life, I really try to get rid of that phone at night and give my kids undivided attention.
Absolutely.
It's rare that I want to take an email or a phone, text at that time of night. So I do kind of disconnect. I probably don't even do it as much as I should, but I try to do that, and I try to encourage them to do that because it does lead to, it could stop and change your whole situation in a heartbeat just from a text or a quick email.
Exactly. So it's great that I see that you are self-monitoring and also teaching that skill to your kids, and that's the first step. Honestly, a lot of people probably aren't aware of how social media can affect them. So I think taking a step back and monitoring your reactions, your automatic thoughts, and then how you behave afterwards. I think that there's a lot of room there to shift things around and make things easier.
Absolutely. Well, it's all about time management and figuring out what works for your life. And, I think that's just a huge part of it for me. I didn't think I'd be raising kids and dealing dealing with these issues. You know, life is hard enough, and then, you know, you have a family, and it's a lot of different things to juggle, and it really is time that we're losing. It's time that we're losing and figuring out how we want to spend it.
Exactly, exactly.
But that's over accessibility, you know, like being able to be accessible to everyone all the time.
Yeah, it's important to set limits and to take care of yourself. You know, you're a mother and you're a provider, and in order to take care of others, you really need to take good care of yourself. And you're doing that, so that's great. But I think there's always room to advocate for that. And a lot of my work has been with caregivers. So that's also counterintuitive. In order to take better care of others, you need to take better care of yourself.
So Nicole, tell me, I know that you have a specialty of dealing with patients that have gone through cancer with anxiety and depression. Tell me a little bit about that and how you help those clients.
So the good news is that cancer treatment is getting a lot better. So patients are surviving longer. However, there are a lot of common symptoms and side effects associated with cancer and cancer treatment, and certainly anxiety and depression are two of the main ones. Oftentimes I see that chemotherapy can really bring mood symptoms out, and as well as patients often have fears about recurrence even when they're in remission. So I practice medical psychology, and I work with patients at all stages of disease. So in at first being diagnosed and how to manage the treatment plan and all these new things that they have to think about, as well as adhering to treatment, and then also when patients are in survivorship or remission, getting back into life and navigating fears of recurrence, as well as end-of-life issues. That can also be important work.
That's amazing. I know for myself, dealing with clients with cancer, you know, it's been so rewarding. I think that it's so great that you're able to do that, and even just for me, helping them with their appearance is everything to them. And, you know, just giving them a hug and letting them know that we've got this, you know, we're going to handle this for you, has been amazing. So I can imagine you giving them the tools to deal with that, or even just the method of being able to talk about it is huge. And to tell them that they're living, you know, they can live past it, and then even just help them live a more viable life through it and during it.
Exactly. And what you do for your patients is wonderful. I mean, body image is such an important component of living and quality of life, and so it can really, really help patients.
Well, for me, it's dignity, you know, giving them dignity and dealing with that through it, and absolutely has been very, very, very rewarding.
Exactly, and it helps patients feel like themselves again, and it's one of those quality of life factors that maybe medical providers aren't focusing on, but should be a part of our standard of care.
Absolutely. I think it's going there. I really do.
I do too.
And I really believe in the psychology aspect. You know, this is so important to me to have this show today, because I know it touches everyone's lives, but no one wants to talk about it. And it's very difficult for people to get to a point where they want to go and open up, you know, to a therapist. So I think half of it is getting people there into treatment. And if you had to say something to our viewers at home to get them to realize what a benefit, you know, coming to see you would be, tell me what that would be.
So with therapy, certainly there can be a stigma out there, and I think the idea that people have about therapy is that you come in and the therapist asks you about your childhood, and you go into all these memories, and there's a lot of work there. But really, the type of therapy that I provide is cognitive behavioral therapy, and it focuses more on the present day and giving you actually tangible skills that you can work with on a daily basis. So you're learning a skill set to take care of yourself and better manage your symptoms and side effects associated with cancer or other medical problems, or just depression and anxiety, to help you live your daily life. And it's not all about looking at the past. It's about moving forward with your life and having the best quality of life that you can have.
Absolutely. Well, I don't think there's a wellness viewer out there that can't be in need of services. At some point in the road, you know, we all go through a journey in life, and we hit lows and we hit highs, and to know that we can get help and not always have to go right to medication. For us, wellness is, you know, absolutely first and foremost. You listen to the TV commercials, and half of the side effects seem to be worse than the problem at hand. So I just think it is a great option for us to take the veil off of all of that and realize that we can sit down and talk about it and have the tools to deal with the issues and be able to function. I think for half of it is just getting it off your chest and really being able to realize you're not alone.
Exactly. And I would say that as a society, there is this certain viewpoint that they want a quick fix. We want the pill that's magically going to make everything better. But there is no magic pill, and medications take, oftentimes a month to kick in and to start feeling the benefits. They also have symptoms and side effects. So I would recommend if you're not sure if you're having some symptoms of anxiety or depression, or you're not just functioning at your optimum level, come talk to a therapist and try to figure it out together, and then you can make the decision, an informed decision, about whether medication is right for you.
And a few tips you would say to lifting mood. What are some of those things that we can all do to kind of, coming into the holidays now, and you always hear people getting depressed and anxious, what are some tips for everyone that we could do to lift our mood?
So I would say that exercise is nature's antidepressant. So I always recommend exercise. I would say also scheduling activities, so social engagements or just getting outside, getting some sunshine. That's always going to be helpful and beneficial. I would say try not to isolate yourselves during this holiday season, and also think about setting boundaries. Sometimes family dynamics can bring up a lot of stress. So think about the small steps you can take to take care of yourself better.
That's excellent. Well, we have really enjoyed having you on the show today, and this has been a long time coming for us on Wellness Woodbridge. So I can't wait to speak to you again and hear more about some tips that we can do to help everyone, because this does affect and touch everyone's lives.
Thank you so much for having me.
And I know you're accepting patients.
I am currently accepting new patients, so I appreciate
that. Sounds great. We're so glad to have you.
Great. Thank you so much.
So thank you so much for joining us today on Wellness Woodbridge. This was a great opportunity to talk about anxiety and depression and Mental Health Awareness Month. We're so glad that we could bring these issues out into the forefront, and we hope that if you have any of them or you're experiencing any depression or anxiety, that you realize that you're not alone and that you can definitely go get help from a wonderful professional. So thanks again for joining us, and we hope to see you again soon.